taking measures to ensure good sanitation and hygiene, especially among those selling food items in the city. Other reports have indicated that some unscrupulous people are collecting water from the National Channel and selling it out to unsuspecting members of the public. Now, health experts and political leaders say that the sudden outbreak of typhoid in Kampala and neighboring districts and how it has been handled is a vote of more confidence in how we are managing public health matters. So tonight on Spectrum, we discuss this matter as we look at the measures being put in place to strengthen our public health systems and quality of water at our disposal. Our guest, Dr. Monica Musenero, head of disease surveillance, the disease surveillance team at the Ministry of Health. She was part of the Uganda medical team which fought with Ebola in West Africa. You're most welcome, Dr. Musenero.
Thank you very much.
We also are joined by Engineer Alex Gisagara, Director Engineering Services at the National Water and Sewerage Corporation. You're most welcome, Dr. Gisagara.
Thank you very much.
We're supposed to be joined by Dr. Willington Amutuhaire, the Supervisor, Epidemiology and Disease Control at the Kampala Capital City Authority. Dr. Musenero, how explains the current typhoid outbreak?
Thank you very much, and I greet all our listeners today to talk about this typhoid. Typhoid outbreaks are common, especially in countries where our sanitation is not yet good. So this is not exclusive to Uganda, but there are situations that happen when the germ that causes the typhoid, called salmonella, accumulates in the population. And when it accumulates in the population, especially during dry seasons, when people drink a lot of water, and then there is some situation that compromises the quality of that water, then usually you see an increase in the number of typhoid cases. And when they cross a certain number, which we monitor, when it crosses a certain number, then we say there is an outbreak that warrants interventions like we are having now.
So it's possible, like with malaria, for someone to have this salmonella, I don't know if it's a virus or a bacteria, to have it in your system, and it is suppressed because it's not reached the breaking point.
Yeah, it's not, every time you have a typhoid outbreak, many typhoid outbreaks go unnoticed, because unlike other outbreak diseases that show very, very large, they show in a scaring manner and they are seen very quickly. Typhoid outbreaks tend to run underground, and if you really are not very, very careful, you may not notice them for a while. Now, every time you have an outbreak, 5 to 10% of that people get infected become what we call carriers. So if you have this repeated over and over, that number of people accumulate in the population, and then they continue now contaminating. So if, as in this case, we found out that there was a lot of contaminated water being consumed by people downtown, especially around the parks and the markets, then because these people are shedding the bacteria, it's a bacteria. It's a bacteria, and there are two types. The salmonella type is exclusively human. It only infects humans and is in the environment. So then when people take it in, many people are taking in contaminated water, then we see increased infections.
You're saying because it's a dry season, people drank a lot of water.
Yes.
That's why we have that.
Yes. When there is a dry season, people tend to drink a lot.
So then
taking, there are many factors that follow that. Because people are consuming, then these drinks are on market. So then the people who are selling tend to make shortcuts.
You're saying this time the variable was that the dry season people are fasting long, fast and longer. They drank more water, but the type of course have been the same.
Not really.
The contamination.
Definitely they are, by the time you are taking in, and then there has to be multiple factors. The bacteria has to be in the environment. Then it contaminates the water. Then the people's behaviors have to be in such a manner that they consume the water. The water which is contaminated. And when they are taking in a certain number, then more people get sick.
Well, we've just been joined by our third guest, Dr. Willington Amutuhaire, Supervisor, Epidemiology and Disease Control at Kampala Capital City Authority. You're most welcome, Dr. Amutuhaire.
Thank you so much, sir.
Tell us what happened this time. Some people tell us big buildings in Kampala, they operate on wow. boreholes and the water coming from underneath is not clean. Is that what happened?
Yeah. True. We've had challenges with people that operate businesses downtown. Instead of using national water, they instead depend on underground water, which they pump and connect to national water lines, and they supply to these people. Of course, you cannot be certain on the safety of this water because it comes underground. Kampala is in a swamp area. So sewage, everything that is in the soil, when you are extracting water from underground, it comes along with everything that is within the soil. So if this water is not boiled, obviously it will contain pathogens.
Let's get this clear. Somebody has, assigned himself the job of providing water,
Yes.
like national water. They have their big borehole somewhere, and they inject this water into the system, the main systems. Is that accurate?
I didn't get your question, but what happens?
Where does this water come from? You say there's somebody who's acting like national water. They pump this water from underground and feed it to the national water system within the capital city.
Yeah, there's water underground. If you dug a deep hole in the ground, the water will come out.
Yes.
So this is what happens. And people pump that water upwards, and then they connect it to the taps of national water.
Owners of these shopping malls, because that's what I said, they have boreholes, then they pump water into their systems.
I wouldn't want to call them boreholes, but they are holes.
They are streams. They are like streams. When you see Kampala, you see a lot of streams and swamps. So if you clear an area, that water will collect there. And the Kampala is a crisscross of streams. So most of these places have been built where there are those streams. So when you prepare a place, that water will collect, and when you have a submersible pump, you can pump that water. So basically, these people who are
shopping mall owners have created boreholes in their building.
Yeah, and they fool the people because this water, when you turn on your tap, it comes out. And they even have national water connections.
How did you license them to do these kind of things?
No, actually, we didn't license, but of course, if somebody has a hole in their buildings concealed, you will not know. If you come and you are inspecting for a bit of water and you open the tap and clean, while careless water is flowing, you will not know that this is water from national water, this is water from underground. So it's until that this epidemic came in, and of course the information started coming out, the occupants of this building started alarming us.
Right. So what is the trigger point? What gets this typhoid in?
Of course, as we've said, water comes from...
They've been using this water at normal levels and there was no problem because the sun has been shining, people like us, they've consumed higher levels of water. If there was no, the consumption has not gone up, would have continued like this since the
What Thompson has said, we've had typhoid in the country. Typhoid is there in the community. But if there's increased consumption of foodstuffs or the drinks that contain it, then we have to get the numbers getting increased.
So the dry season, was a trigger.
Yeah,
so what are you people going through?
And again, in dry seasons, I think there's increased concentration of this salmonella in few water in rivers. So dry season is perpetuating increased concentration of these pathogens in water.
So the sun was a blessing in disguise this time. So what are you going to do this time?
Some actions have already been taken. We are inspection team is closing malls per mall, and people are complying. People are stopping use of this water and getting to the national grid, the national water. And the springs are being closed off. For example, the one in the old tax park.
There was a spring there?
Yeah, so it has...
Who was managing it?
No, the tax park occupants were... When it was, I think, as old as me, people using it, but I think when water from there was tested, it was highly contaminated with fecal pollutants.
So even some of these springs, some of us grew up around the city, some of these springs that we use to cruise and back and other places, some of that water is not clean? Is that...
Absolutely.
Even though it comes from underground?
But you see, underground contains sewage, for example, in camp.
But it gets sifted, does it? It doesn't get filtered as it comes before it gets a spray.
No, these are microorganisms,
They could go through.
Yes, the saturation issue comes on board.
Engineer Alex, you people have made your water so expensive. That's why people are opting for these things. Why do you charge water so highly?
Dear listeners, our water is the cheapest commodity in the world. 20 liters jerrycan at 32 shillings.
That's what you charge?
Yes, that's the best commodity we are selling. And even to make sure that we sell it at 32 shillings, we have installed prepaid meters, so there are no vendors, no people exploiting our customers. So I should comfortably tell you that the tariff we are charging the lowest, even if you compare to the other service providers. If you go to Europe, go to America, still national water gives you the best price.
So the problem is not the price. People should get onto your systems.
Yes, the problem is not the price, it's the mindset. Some people spend a lot of money on airtime, on drinks, and they feel that they don't care for this commodity which they feel is God given. From the times of Idi Amin, the president who declared that water is free from heaven and some abundance, make Victoria the full, so she had to pay on the coin. So we need to say that our water which is the cheapest, people should give it the value it deserves.
Right, but you don't have enough of it. That's why people are improvising.
We have enough water. What we're talking about is equitable distribution of water. We talk about 24-hour supply. What does it mean? If you have a tank, an overhead tank at your premises, take example of 2,000 liters. That's enough water to take you for 3 days if you are using it sparingly. And if we get an interruption, that means you can still comfortably have that water for 72 hours. By that time, we should do immediate action. We come on board, we shouldn't have a lot of stress. The problem here is people, when they are building their houses, they are putting very minimum storage. This is an economy, a third world economy, where not like Europe, we get direct pressure, direct supply, there are no power failures. We operate sometimes on intermittent supply because of power outages, maintenance. Any system which has to be serviced, overhauled, definitely should have security of supply by storage.
And which other towns do you supply apart from Kampala?
We supply almost 90, up to now it should be comfortable to talk about 96 urban centers in Uganda.
96 towns?
Yes.
But you always switching off water. Recently you cut off water for 3 whole days.
Yeah, that was 72-hour shutdown. It was actually a program. We are replacing our old pipes, getting up to 8 years old. It's an upgrading and asset renewal. We have a project which has taken more than 2 years. The preparation stage, we are now in the implementation stage. We feel comfortable that when we upgrade our system, when we replace our pipes, we get a better service. So this one, the 72 hours was not intended to deny our supply in most western parts of Kampala. We feel that people accommodate in their supply service delivery. The interruptions have to be there. The security of supply, it is accompanied by storage.
So there's no problem with the price, there's no problem with coverage. The problem price is quality. Is your water clean enough always?
Yeah, the quality issues are not really substantial. We are talking about World Health guidelines, Uganda National Bureau of Standards, international level. Our water meets the standards. We treat it to the perfection it deserves to be called wholesome. And we distribute it. And when we distribute it, we also have post-treatment. We have what we call residual chlorine. We keep it at 0.5 milligrams per liter to make sure that any ingress of fine matter, important, is demobilized and the water remains safe.
And you're telling us the last time that you can drink tap water if it's not gone through a tank these days.
Yes, last time I mentioned what tap you're talking about. If the tap in the bathroom, in the washroom, don't call that our water. The tap in the kitchen, direct from the main, is fully protected. It has security in terms of residual chlorine for post-treatment, and you are safe.
And normally they color them blue, I think, on the outside, just to distinguish them.
Yeah, that's a natural water color.
I mean, the pipes themselves.
Yes, this is what I'm saying.
Plumbing them, normally the ones that got historic, they color them black. Yes. This is what they color them.
That's a grey color to indicate that there is protection for pollution, because most of the tanks are not covered. We have a lot of lizards, droppings from birds, and people don't wash up to 1 year to 2 years. Then that water has been degraded, it's no longer water. It has changed its composition, and there is no security in that respect. So bathroom water, the household water for washing, don't drink it direct. No.
Well, listeners, this is Spectrum on Radio tonight. Are you satisfied with the manner in which the current typhoid outbreak has been handled? Our guest, Dr. Mani